To me, safety means the creation of an environment that promotes the prevention of risk and injury, and that affords protection for all of our patients, whether they're undergoing a highly complex interventional procedure or a non-invasive screening examination.
When I think of high-quality medical care, I think of quality and I think of safety. Quality being optimal, timely, appropriate, high-level treatment for patients. Safety is different. Safety is avoiding errors, because you can provide high-quality treatment and still have errors if you don't proactively try to prevent these errors.
To me, safety is top priority in healthcare. As doctors, we all take oath to first do no harm. Taking an active role in safety efforts for our patients, I believe, is one of the most significant ways we're able to protect from harm. I feel we all should be making daily efforts to minimize preventable adverse patient outcomes and staff safety events.
Safety for me at VCU and being a physician at VCU means a bunch of different things, really. I started at VCU about 18 years ago in medical school, and so I've watched the university kind of change over time and really just for the better every year. And a big thing that happened in the 2000s was really an intense focus on safety and a quality commitment, and that really came from the leadership top down, both at the health system and within the Department of Radiology.
The concept of safety extends not only to our patients, but also to our employees. Particularly pertinent to the practice of radiology is radiation protection. Over a decade ago, our department led the way in creating and implementing an enterprise-wide radiation safety initiative. This initiative promotes the safe use of radiation not only in the Department of Radiology, but also in all areas of the medical center.
Safety has really become the primary focus of really everything we do in radiology, and certainly as a proceduralist, as an interventionalist. It's something that's on my mind all the time.
To me, the first step in creating a safe environment is to recognize that safety is indeed a team effort that requires the participation of all individuals involved in the care of a patient.
We have developed numerous mechanisms to create a more safe environment. At the very top in radiology, it starts with the Radiology Executive Committee, where we have a multi-hour conversation every week, not only about operational issues, but also about safety issues. And we talk about any safety concerns. We talk about safety concerns from other subcommittees. We talk about safety events that may have happened, and we develop policies and protocols to prevent those errors from happening again.
In radiology, this is important in every aspect of patient service, from our environment and patient care spaces to all interactions with staff, starting with privacy at check-in and accurate registration for patients, to the imaging done by technologists, and then on to the physician consultations and also in planning for any follow-up imaging or treatment.
One of the best things I think about practicing at VCU is just the number of physicians and staff members that you can emulate, that you can look to and find that role, that leadership, and those positive qualities to make you a better clinician, a better person. I've pulled on so many different people that I've interacted with who have that great safety mentality and really create this safety culture. So in my interactions with patients and my interactions with staff, I really try to think about those things actively. And the more you actively think about them, the more they become part of you and just innate behaviors.
Everybody listens and we discuss the patient, make sure we're doing the right patient, the right procedure, the right variation of the right procedure. And then on a daily level, we have huddles every day with the nurses and the technologists and the physicians to discuss patients, safety concerns, potential issues, so we can figure them out in advance.
It starts before the patient arrives and it goes well beyond the patient leaving. It can be initiated by any team member really through a standardized system so that the patient's safety net and reporting system allows really anybody to raise a safety concern. And once that concern is raised, it goes through a standardized process of evaluation and hopefully ultimately some kind of implementation of a change that is only designed to improve outcomes for patients and staff. The safety is something that is ever present. It's something that we do every day in our interactions with patients. It happens every day in our debriefings as a team. It happens in our case review analysis after the fact. People can hear me saying all the time with my patients when we're prepping to do a procedure, whether simple or complex, the message is always the same. Your safety is number one, getting it done is number two. And I really mean that. And it becomes very important when you're doing the most basic procedure, because even small mistakes can have profound consequences in medicine, to doing the most complex procedures that are relatively high risk. Just because something is high risk doesn't mean it can't be safe.
Staff takes procedure safety very seriously. For all procedures, we verify patient identity, appropriateness of the biopsy and localization type procedures, and confirm understanding from the patient prior to starting all procedures. To be successful at these efforts does require great attention to detail and no shortcuts attitude from the whole department.
As a leader in the Department of Radiology, it is my goal to ensure that our individuals, whether they're employees that are consistently in radiology or those visiting our department, such as anesthesiologists, feel that they can speak up in any situation, irrespective of their role, for the good and safe care of our patients.